The comedian Tina Fey once said, "You're just like a human napkin for kids. Like they just wipe your face on you and stuff." Welcome to the Mummafesto, the podcast where parenting and politics combine. My name's Stella Creasy and I'm one of the candidates in the general election standing for the Labour and Cooperative Party in Walthamstow. My guest this week is the amazing campaigner Rosamund Kissi-Debrah. Rosamund's incredible campaigning work began when her child Ella died at the age of 9 years old. The inquest into Ella's death made legal history by ruling that air pollution was one of the causes of her death. Rosmund has since set up the Ella Robert Family Foundation, which provides support for children with asthma and campaigns for cleaner air. Rosmund, thank you so much for joining me today on the Mummafesto. You are one of the first people I thought about when I was putting together doing a podcast about how parenting and politics combine, because I am in absolute awe both of your strength in what is a horrific situation and the impact that you've had. To those people listening to this who don't know your story, why don't we start at the beginning? Tell us a little bit about Ella.
Yeah. Firstly, let me introduce myself. I think, in case I always have to do that, in case people haven't heard about me before. My name is Rosamund Kissi-Debrah, and I'm the founder and director of the Ella Roberta Foundation, which was set up after my late daughter died from a very severe asthma attack. And I have another role also as a WHO, a Breathe Life ambassador. So for people who don't know me, that's my background. And as Ella, that's a Freudian slip there. As Stella mentioned, Ella was my eldest of three, and she became suddenly ill. And as parents, we're quite used to our children becoming ill. I mean, definitely up until the age of 5. I think some of us go to the GPs quite often with colds and things like that. But Ella actually wasn't a sickly baby. So I think apart from her injections, and what I mean by that is, if you saw Ella's GP notes now and you said, "Oh, take a guess where this child is right now," yeah, definitely not that she has passed won't be the first thing that comes to mind. She became ill very suddenly, and it manifested itself as a severe cold. And a cold is something us parents get quite used to, and temperatures and things like that. So when it first manifested, I'm not going to sit here and tell you I was worried, because I wasn't. And it was half term, and I thought, oh, okay, great, it's half term, so you don't have to have any time off. And hopefully by the end of half term, it would have disappeared. So I took her to the doctors, as you know we do, got her some antibiotics. I think when we got there, I think she had a chest infection. So they didn't give her the antibiotics because she had a cold, no. But I think they realised she had a chest infection. And unfortunately, it actually didn't go, because she then developed this cough, which will probably still stay with me now, as that cough began to be quite dominant in her life. And then I remember when it came to after the half term, and her nanny Fiona came back at the time. I remember saying to her, "Oh, can you take her back to the doctors, because whatever she's got has not cleared up." But I still wasn't concerned. Why would I be? Not really, because I just thought it was a cold, a cough, and she might need stronger antibiotics. But that was the end of October. So the October half term, which is the last week in October. So we're going into November now. And I think because the cough was so dominant, we went back to the GP again. And I remember at the time she went, "Do you know what? Let me refer you to the hospital." But I must admit, still, I wasn't. It's like, oh, okay, she's got this cough. Okay. And when she referred, and I can't actually remember, we might have had one outpatient appointment. We might have had, but it's so long ago now. This was in 2010. I think we did. But at that time, no one diagnosed her with asthma. They actually wouldn't have, because there was no history. Do you see what I mean? She had, up until that point, there was no history of it. But I remember that cough, Stella, never really went away. And when she broke up for the Christmas holidays, the first time we ended up in hospital was the 21st of December 2010. And I remember the GP had given me the blue inhaler because of all her coughing, and she was breathless. And she'll say, if she's like that, then you need to give her this. And I was on the top floor and she was down. And one of the things I had done is, rather than me coming down the stairs, like, in the middle of the night, I'd actually got her to lie next to me in bed. So if she woke up there and then, I can give her medicine. I will never forget it as long as I live. When she started coughing and she went stiff and she went blue. I seriously, even the shock of it, even till now, because she had never done that.
Yeah.
And I did the most ridiculous thing now ever. Literally, I was screaming because that had never happened. And I remember at that time, she wasn't even 7. So I kind of lifted her. I mean, I'm so embarrassed to say. And I ran downstairs with her. I was screaming that loud that my neighbours, literally, because it was in the middle of the night. So, it's really quiet. And we live on a really small road. So I was like, help, and I remember Gary, who was living opposite me. Of course, they heard me. And I remember them bobbing. He was just across the road, and he gave her CPR. And if he hadn't done that, I don't think I'd be sitting here now talking to you. She literally would have died there and then. So when he gave her CPR, obviously we called an ambulance and the usual. And I remember going to hospital and they were asking questions because they didn't know her. Like, what happened? Who is she? Because they had no history of her. Then exactly, and obviously what had then happened is all her oxygen, all the numbers were okay and everything. And we were literally back home the following morning. And that was it. But I was nervous because the fact she'd done that, because in hospital they hadn't really done anything. Probably put her on a nebulizer or something. But you can imagine after having that scare,
It
obviously,
must have been terrifying.
oh no,
Absolutely
it really, I am still grateful to Gary now. And he will say to you 14 years later, he did nothing. But when it first happened, I wasn't in the mindset to start resuscitating. It was a shock of it. She literally went stiff and blue. And it was just shocking. But a week later, the same thing happened again, unfortunately. And I remember that morning we had gone to hospital because we were going to see a pantomime in the afternoon. And I thought, don't want any of your weird things again. Let's go to hospital. So we kind of went. They checked her out. They said she was okay. And I remember saying to the junior doctor, are you sure I can take her? She was like, all her oxygen's okay. Yes, you can. Went to see the pantomime. She was still coughing. Again during the night, the same pattern repeated. This time, unfortunately, when we got to hospital, she wasn't so lucky, and she got put into her first coma.
Gosh.
How many people will cough asthmatic and put themselves in a coma? So in the beginning, they weren't sure, but as time went on, you can see her kind of it sort of stopped from probable to put severe asthma, and that was the beginning. And when I look at it now, and even talking to you, she wasn't like that every moment, every second of the day, obviously. But when she was like that, our lives stopped, and it would revolve around her. And the biggest break we actually got, believe it or not, was during the Olympics 2012. For some reason that no one will probably be able to explain, during the Olympics and the Paralympics, she was well. And I remember saying to her, which was wishful thinking, I was like, Babs, maybe the same way this thing just suddenly came, maybe it's gone the same way. And I can't remember when the Olympic, maybe June, July, the Olympics was, and we were going to Queen Elizabeth. And I can even picture her when, there were all those volunteers and they had like these massive hands. And when you get there to see things, they were all high-fiving you. And it was a great, 2012, that part of it was great. And I remember for the events we didn't have tickets for, we would go to Blackheath, the Common. They had like a huge screen and we'll sit out there. And it was just great. But around the end of September, I just won't forget it. There was that kind of, and I remember we both looked at each other because from that little thing, I then knew it was going to start again. And yeah, lo and behold, it kind of did. And she still went back to school. And then when they broke for Christmas, she was at home for Christmas. But in January, those days, you got really proper winters. It was really cold. And I remember, by the way, because at the time, Heidi Alexander, I don't know whether you know her,
Yes,
she
yes.
she was our MP. And at that time, she was the Shadow Health Secretary. And there was a threat of either the maternity unit or something to do with Lewisham was closing down. And Ella was so political, yes, even at that age. And I remember she wanted to go on the march, and her consultant was like, absolutely not, with the way you carry on. And Ella's like, yeah, but there's going to be doctors there. I'll be fine. And she was going, absolutely, you won't be allowed to go on it. And I remember, she was battling with me over it. And I was a bit like, I'm not prepared to battle. When you have your outpatient appointment, which was before the march, let's see what your consultant says. If she says you can go on the march, then I'm going to give in. I remember when she told Charlotte that, oh, I want to go on the march, and Charlotte was going, hell no, and she actually sulked because to
How old
children,
was she back then?
she was 8 because it
Yeah.
was January 2013.
You will chime with people listening to this who have children with serious health conditions that they're also children who just want to be kids, and if their mates are doing something like marching, of course they want to do that themselves.
They want to do that. Ella was a type of child that Stella, when she was either now, and now one can sort of say it because time has moved on, she was either close to dying or she was okay. And when she was okay, her first request was she wanted to go back to school.
What did you understand might be the cause of it? I mean, why she had developed such severe asthma? Did you have
We were
time?
we were looking. She got tested for cystic fibrosis. I know it's a long shot, but when you're desperate, she got tested for epilepsy. She stayed at St Thomas's overnight to do a sleep study. They were basically looking. And the reason why we ended up at Great Ormond Street was the local hospitals felt they had done all they could. And Great Ormond Street is when you have very severe, as you know, cases. And Dr. Wallace, may he rest in peace. He's since passed, and I went to his funeral just a couple of weeks ago. He was trying to look for something. Do you see what I mean? Outside the box for her. And I always remember his conversation with her, October 2012, that she should give him time, that this is, he got given her kind of notes, and he looks at it and he thought, oh my God, they've done everything they can. So he needed to look for something extraordinary on top of that. And I remember his conversation with her because on the day she went to see him, she was very well that day. And it was really interesting what he said. When she was well that day, he said she would be in the top 10% of children for healthy children when she was well. So can you see the extreme? She would go from that to almost dying. So something, do you see what I mean? It was that extreme. 1.1 million children have asthma in the UK. In London, 250,000 children between the ages of 5 to 19 have an asthma diagnosis. I'm sad to say that the number of children who die in London is still somewhere between 8 and 12 every year. So if you think about it, this year we will still lose that many children. Nationally, it's about 22 to 24. And this is a preventable disease, really, because there are Scandinavian countries like Sweden and Finland, who don't have the level of deaths we do. We did have a period, interestingly, where there were no asthma deaths for the first time. And that was during lockdown, the first lockdown, when Boris locked the country down between March and July. And I always say to people, I'm sad to say, when it got reopened on the 4th of July, I think a month or just over a month after that, someone then died in London again. So I know that it can happen that children can, but it is the number one reason why children won't go to school in this country. So respiratory is a big thing for children in this country.
If you can, tell us about the 2013 and what happened with Ella.
Well, I mean, I obviously I'm not going to go into details, but to say that she'd had many attacks, and she had another one, and at that time, we didn't think she was going to die because she had come back so often. I think if we knew she was, you can imagine the mayhem that would have been in the ambulance. But because she'd come back so often, you just thought she will make it this time. But when I'm sitting here now, 11 years on, I don't know whether the success rate of resuscitation is like 33%. So at some point, unless something happened to intervene, she was always going to go. And yeah, I still feel, I mean, I think it was over half an hour to get her back. I think afterwards, I was like, oh my God, we haven't broken anything. Or do you see what I mean? It will remain as the worst day of my life, apart from obviously the funeral. But basically, it was no different. Someone will say, what was different about that attack? Nothing. So she, all those attacks she had, she could have died any time, but unfortunately. But the one thing though to actually note now, which is not, which I do need to add in, is on the 14th of February that night, air pollution, the spiking was at its highest it had ever been at Lewisham at that point. But at that point, we didn't know that, if you see what I mean. In 2013, we didn't know that. We subsequently found that out later on.
Sure. Well, and I think, say, people listening to this, their hearts will be broken that you lost your daughter.
Oh,
point at which you began to draw a connection between what was happening to her and air pollution. Tell us a little bit about that.
Well, we'd had the first inquest, and remember I said to you, we didn't really know all these attacks. We'd ruled out. You can imagine all this. I mean, we'd ruled out dairy. We'd ruled out virus. We'd ruled out. So I remember at the first inquest, one of the things they weren't able to establish is they said that her triggers were something to do with something in the air. And I think, Stella, it's very easy now to sit here and go, oh yeah, it's air pollution. At that time, we didn't know. And I remember, so when a child dies suddenly, you have a child death review, which you probably know about. And I remember Donald O'Sullivan, who has since passed, saying to me, I think he was trying to be kind to me, because I was like, oh, can you leave? I actually said to them, and I think they were waiting to get the notes from the inquest. And so this had come back, that her triggers were to do with that. And he did sort of say to me, oh, Rosamund, there are lots of things in the air. And, how can we... So I think he was just trying to... It was just...
Was it the coroner?
Sorry?
Was this the coroner?
No. This was a child death review locally.
Oh, okay.
And I think he was just really trying to be kind. I think everyone who knew about her story knew what I'd been through. And he didn't really want me on another wild goose chase, if you see what I mean. And he was right. Something in the air. If for example, you go to the doctor and they say, oh, Stella, your child is allergic to do with something in the air. Well, that could be anything. And he was quite right to kind of like, let's get this in perspective. But I remember the local, and this is where local newspapers are fantastic. A journalist, Mark Chandler, had come to the inquest to cover the story. And those days, nobody knew about our case. And I remember he sort of introduced himself to me at the inquest. And I was a bit puzzled. I went, how do you know like the inquest is happening? And he sort of said, oh, we get given a list of names, and I saw your daughter's name and I thought this might be interesting, so here I am, sort of thing. And at that time, can you believe it, he was the only journalist there. But I remember after the child death review, I sort of went to Mark and said, oh, I would like to put an appeal out if someone can help me get to the bottom of why Ella's asthma was so severe. So it went in our local news shopper, and I did get a few emails, as you do. Someone said, oh, you need to check this, you need to check that. But I will always remember this one guy who said to me, oh, Rosamund, have a look at the air pollution around your house on the night Ella died. And that's what started the whole thing, really.
Goodness me.
Mm-hmm.
What happened next?
I think Claire, who used to live across the road from me, she had worked with my lawyer at the time, Jocelyn Coburn, and she'd seen something on Facebook where Jocelyn was saying, if you believe you're impacted by air pollution, get in touch. And obviously, Claire and I had talked about, because her son had also got ill, because we literally just live off the South Circular. So you can imagine, as parents, because her son had been in as well with a respiratory thing. And then I said to her, oh, and she was like, oh, this lawyer is looking for this. Why don't you get in contact with her? So I did, and I went to see her. And I can always remember saying, oh, I think I've got something for you. I'm not 100% sure, but I think it's to do with the air pollution. And I remember going there, Stella, and their building was like this ginormous building. And I was like, oh God, I don't think I can afford anyone in here. Because by then I had sort of left teaching. I just couldn't even teach anymore. And I remember going in, my kind of opening pitch, don't do that, people. It's not a great one, was, yeah, I think I've got something, but I have no money and I'm not selling my house either, which wasn't a great pitch, was that? But when I told her and a story, she took it very seriously, obviously, and then the investigation began. And it was, I have to give Jocelyn all the credit. It was her who, obviously, every time you are discharged from hospital, it is all logged onto a computer, isn't it? And it was Jocelyn who had all the dates laid out. Then she got all the readings from the South Circular of the monitor, and then she matched them against when Ella was in hospital. And if it wasn't for Jocelyn, yeah, we wouldn't really be here now talking. And that was the first part of it she managed to do. But I think the more difficult one was to get an expert to back it up. Because although she had done that, that wasn't going to be enough in court, was it? You needed, and that was the difficulty about our story, because initially nobody would like touch us. No. Because what it meant is you would have to go up against government, and nobody was willing to do that. And to cut a long story short, Professor Holgate, who ended up being the expert witness, what had happened was, he is based in Southampton. I'm going to see him next month, actually, for the first time going to Southampton. He is the government, he's the UK clean air champion, and whichever government gets in, I hope they work with him. And he'd come down to London for a lecture or something, or he was part of some. Stephen comes every now and then to London, and he was going back on the train. And as you do, I'm sad to hear of the demise of the Standard. He picks up the Standard newspaper, and you sit back on the train. And I just happened to have given an interview in the Standard that day, and Stephen read it, and he read how where we lived, and I was trying, and he put two and two together. And as people, Stephen is the guru in this area, and he said he knew straight away, without even talking to me, what had happened to her. He did. And I must admit, when he first initially told me, I wasn't really moved by it, by the way, I've got to say, because during her lifetime, we'd searched for so many things, and it kind of ended up blank. But one of the things I had done is when Ella died, and she was at Great Ormond Street, that's where children go. I'd got them to take samples from her body. Don't ask what I was thinking about, but thank God I did. And they're kept at Great Ormond Street, which they're still there now. And he went to Great Ormond Street with the pathologist who examined her body, and she had the chief. Ella always gets the top people. It was the chief pathologist who examined her, and Stephen went there to see him. And between looking underneath a microscope and things like that, they could see like the PM 2.5 and things like that. And I remember, I don't know what I was hoping for, because Jocelyn, we kind of knew it was a foregone conclusion. But when Stephen came back, I don't know whether I thought he was going to tell me something different. And I said, oh, what are the chances of that is this? And he was 97% certain. Not even 5%. And I remember going to see him that day in Jocelyn's office, and he'd given me this news. It was probably one of the longest journeys I had getting home. And what I was doing is I was trying to work out how, because I kept a lot from her siblings at that point because they were a lot younger. But coming home, I was trying to figure out how I was going to tell them and what I was going to tell them, because we also still lived in the same house. And I was thinking, how do you come and tell them, not frighten them, not, yeah. That was one of the longest train journeys from Euston to home. And over dinner, I kind of had to break it to them that Stephen has gone, and this is what he has found out. And to cut a long story short, when the second inquest happened, one of the things, apart from saying that it was air pollution, I always remember when the coroner took a kind of pause for a moment and looked at her siblings and more or less said, because they are a genetic link, they are also impacted by air pollution, very similar. And we have been told that air pollution impacts all of us. So no matter where you are, if you know you're exposed to it, but for some reason, my children seem to be more impacted than the general population. I mean, Oxford University are now doing tests and blood tests, and they're going to match it with Ella's DNA, and we may get an answer somewhere why my children are more susceptible than most. We're not sure why. They just
But
are.
yours was a landmark case in proving that air pollution was involved in Ella's death, and the implications of that for public policy, implications for all of us who live in cities, who live near roads. You're South London, we're North London, we have the North Circular round my way, are extraordinary. Tell us a little bit about the work you've done since then with people like the Mayor of London to use that information to protect children.
Yeah, I did. I have to be very honest with people initially, because I had promised Ella that, and it's something I can rest now, that, yeah, especially here, even last week, on this earth, I'd always said to her, Baba, we will get to the bottom of this. And I felt, although she was no longer here, I kind of owed it to her to get to the bottom of it. I'm going to confess, I was so driven. You see, it was my daughter and I wanted to get to, I wasn't thinking about the wider thing, but from an academic point of view, when you start going down this road, then you start researching, and there are lots of articles then. And I think it was a bit of a shock. I still don't think I took on the enormity of it. Having taught psychology, doing stats, and I suddenly realised it wasn't so much in the UK, it was in the States. I found all these studies about air pollution and the impact on health. And at some point, it kind of dawned on me that it's not just her. Although I do admit she was the reason. I didn't start off thinking about everybody. It just kind of turned into that way. And I think for me, the surprise was, although there were studies and there's 70,000 papers there, plus 70,000 plus now, talking about air pollution and the impact on health, nobody up until then, it is not on any death certificate. And even since the verdict in 2020, nobody else, although the WHO do say that every year up to
10,000 people.
7 million people prematurely die, and in the UK that figure is 36,000, and it manifests itself in different ways. So on high air pollution days, we know about asthma attacks, but people can have heart attacks as well. We know about low birth weight now. We know about stillbirth. One of the things, there's been so much research in the last 10 years, which is quite interesting. So they've now found PM2.5 in the placenta of pregnant women. Then on the other extreme, which is really worrying and concerning, is in her dementia patients in their brain. They found PM2.5 there. And there are some cancers is linked to PM2.5. Literally everywhere. Obesity.
And just for people listening to this, when you talk about PM 2.5, how would you describe it to a layperson?
It is the worst pollutant for human health. And you will get it from emissions in cars, so diesel especially, from wood burning, from construction, from dust. So what also, and back to Sadiq and the question you asked, what became apparent in Ella's inquest was the ultra low emission zone had started in central London, but all the experts, despite what side they were on, admitted in court this was something that needed to be rolled out London-wide. And it is very important for me to say here that air pollution has no borders. So if you have air pollution in Lewisham, the borough of Bromley is literally attached to Lewisham. So it's not a case of there's pollution in Lewisham and there won't be pollution in Bromley. That's not how air pollution works. Sometimes it depends on the wind, it depends on the traffic, it depends on so many things. But that's what the whole thing was about. And it is not political to say Boris Johnson started this. This is true. He did. And he had also surveyed schools in London, and 564, around that number, were in areas of illegal air pollution. And my annoyance, and it's not a political thing, because he's a father, my annoyance with him is he had this information, and what he did was literally just open the drawer and put this information in there, leaving it for the next person to deal with it. So the screams about Sadiq this and Sadiq that, this is something Mr. Johnson should have started under his watch. And I think he realised that this isn't going to be popular, which it isn't, because people don't like it. I wouldn't say he panicked. He just chose not to do it because it's not a popular thing. And
politicians and campaigners across the country now dealing with what people call LTNs, and then tend to be we've all had these in our communities. They are controversial because they often involve changing road layouts, and obviously the conversation is very much about the disruption it causes to people travelling. What do you say to people about why tackling air pollution and air emissions matters?
Believe it or not, I have been heavily against LTNs, and people will be like, what? They might be surprised. Now, remember, I am completely science driven, and I spoke to Michael Marmot. I don't know whether people know who, I know you will know.
Yes, health inequalities professor.
And I spoke to him about a month ago or 5 weeks ago about LTNs and this thing. And when you hear the word low traffic, it sounds nice. And what did Michael say to me about it? He said, it might have started off with good intentions, but the consequences have ended up being huge. And the reason for this, and thank you for giving me the opportunity to explain, the reason for this is, I think a lot of it is about behavior. And I think people felt, right, that if we create things where there's traffic and things, people are going to get out of their cars, they're going to use alternatives, which hasn't happened. And you mentioned the North Circular. What has happened now in London is, in red routes, a lot of the traffic has now shifted there. And it is literally at gridlock. My issue with that is, if we look at red routes, which are near main roads, Stella, we have to be very honest. There's a lot of social housing there. It's where poorer people live. Whether it's intentional or unintentional, I even read yesterday, I can't remember where, they've now decided to remove it. I do think people might have had good intentions to start off with. I do. But it hasn't worked out the way they actually thought.
Well, this podcast is called the Mummafesto. We are in a general election now.
Okay, I'll be careful.
No. If I was going to ask you, if these policies aren't the right way forward, what would you like to see if we're going to tackle air pollution and prevent, as you say, these are preventable deaths? What would be the policies you'd like to see politicians talking about and including in their manifestos in this election? If it's not LTNs, what is it? I guess is the question.
Okay, well, let's go back to the coroner. I mean, I can safely not hide, but I can quote what the coroner said. And this is to any government coming in. And I'm willing to talk. I mean, we have written to West Streeting, actually, just to let you know. The coroner, the first thing which he said is, if governments do not tackle air pollution, children are going to continue to die like my daughter died. He has stated that very clearly. So that was his first thing. So that's at government level. Also, he wrote to the Department of Health, the Department of Environment, and the Transport. So the coroner is a learned man. And what he knows is, this isn't just an environment issue. It's not just a health issue, and it's not just a transport issue. So those who are going to form the next government, if you want to tackle air pollution, I'm not talking about the politics and the cultural division. That's not what I'm talking about. The coroner, and also he wrote to the Royal College of Physicians and all the medical people. But the first people to tackle will be government. What he's saying, the departments all need to work together. Manifesto would be, public transport needs to be upscaled. And not just that, it needs to be cheaper. It needs to be reliable. It needs to be clean. And it needs to be safe. If you want to get people out of their cars and take alternative transport, you need to make it easier. And it needs to be worth their while. And for example, Manifesto, you're giving me a chance. I would say, for instance, during some holidays, before people jump on that, why not make public transport free? So parents getting just for the 6-week period. And I think more people, public transport is very expensive. And people who live in London, they'll start nodding and going, especially if you're going into zone 1. Second thing, which the coroner said, councils need to monitor it. So not just monitoring it and keeping it to themselves, but using it to raise awareness. So if an area is, if for example the pollution is really high, and we will hopefully have something, there's something in the pipeline we are doing, monitor it, but also let the residents know. So when you bring in schemes, they will be more supportive. But the biggest thing, Stella, if you said to me on a manifesto, there needs to be a public health campaign which is government driven, not little councils. It needs to be nationwide. They need to come out and say pollution is bad for your health because of this, because of that. And the last thing the coroner asked, which we are working on it, is everyone, remember I said to you, we didn't know when Ella died. So everyone in health, and I must admit, the people in health have taken this on. I went to a conference recently with asthma nurses. I'm going to a conference very soon, I think at the end of June, and I'm talking to GPs. They have embraced this. And for any new government, this will be my big thing to them. If I had a manifesto, you won't be able to solve the National Health Service crisis unless you clean up the air, because that will be preventative. So you're stopping people from becoming ill in the first place. Right now, we seem to be talking about cure, but what I'm talking about is you are preventing people from becoming ill in the first place. And I've heard we're streeting and other people, things like, we're going to put more money in it, we're going to do that. Unless you deal with social care at the other end, and unless you clean up the air, you clean up the water, you are never going to solve this actual issue.
Literally. Well, at the risk of being another politician who comes up with a great idea that you hate, I think I am going to lobby, if I'm re-elected, for you to become the UK's clean air czar, because I think I just want to put you in charge of sorting all of this out. By the way, I suspect people listening will agree with me very strongly.
Stella, can I say, I have never said it's going to be easy. Behaviour change doesn't come easy. And also, it is going to cost money. But the amount of money air pollution costs, our lives, the National Health Service, the economy even, it is worthwhile cleaning up the air. I'm not going to sit here and say to you, no one's going to get ill, but I kind of look back and think of things. And yes, there are other things like diet and all sorts of things. But when I was younger in school, 1 in 9 of us would get cancer. We're now down to 1 in 2. And for example, let me give you an example. Lung cancer, 30% of it is down to air pollution, and strokes, 20% of that is down to air pollution. So I'm not saying no one's ever going to have a stroke, but the numbers were, and that's my concern, by the way. Yeah. So there you are. If you gave
Rosmund,
me
I'm afraid you've got no option. I think we have to draft you to lead this as a national mission, and I just want to thank you so much for being on the.
Oh, thank you,
Derek, because also I feel like I've got a little insight into Ella and what an amazing young woman
she was. Thank you. That's very kind of you.
And I think people listening to this will be absolutely blown away that having had something as horrific as that happen, you have turned this into such a clear carrion call for change. And I suspect people want to know where to sign up. So I will put lots of links in the episodes for people listening so they can find out more how they can help me in my campaign to make sure that you are our first UK clean air czar in government. Sorry, Rosamund, I think you're going to have to be very, very busy in the coming months.
Can I just say thank you to you? And the reason why I continue to campaign is because children, as we speak now, continue to die from asthma. And maybe one day soon, before my time is up, no child would die from asthma ever again.
What a brilliant, brilliant ambition to have, and one I think we'll all want to do what we can to help.
Thank you so much for having me. Really appreciate it.
I hope you've enjoyed listening to Rosamund's incredible story and seeing what a phenomenal woman she is. You can find out more about her foundation in the links attached to this podcast. And if you want to join my campaign to draft her to be the UK's clean air czar, please do share this podcast and spread the word. Thanks for listening to today's Mummafesto. Please do listen to our next episode.